Mental health is the biggest health issue facing young people today. 1 in 5 people will develop a mental illness, and a shocking 3 out of 4 young people who need help won't get it. The result is that suicide is the leading health-related cause of death for people aged 15 to 24. And despite all this, no one talks about it. Why? The answer is stigma. Stigma is a collection of negative attitudes, beliefs, stereotypes, and behaviors around mental illness and mental health in general. Like any other prejudice, it divides, excludes, and isolates people who are labeled as different. Fueled by fear and misunderstanding, this stigma can prevent people from acknowledging their own mental health issues and struggles. And even if someone does acknowledge an issue, stigma can be a barrier to them speaking up and asking for help. But what makes this stigma really ridiculous? We all have mental health. 1 in 5 of us will suffer from a mental illness, but 5 in 5, everyone has mental health. Our mental health falls on a spectrum, and where we lie on this spectrum can vary over time. This is just like physical health. People aren't either totally healthy or horribly sick all the time. They often fall somewhere in between. Mental health is similar, except mental health is all about your thoughts, emotions, and behaviors. Healthy, stressed, struggling, crisis. When you're on the left side of the spectrum, you're healthy and in an optimal state. But as you move across the spectrum, there are more and more negative symptoms, and you begin to lose control over them. Diagnosable mental illnesses are a separate part of the discussion. Those with mental illness are more likely to frequent the difficult areas of the spectrum. However, whether you have a mental illness or not, you can find yourself anywhere on this spectrum. We can all struggle. Someone who is struggling will have intense, long-lasting negative emotions that are having a major impact on their life. If you notice these things in yourself, be sure to talk to someone and seek the help you need. If you recognize that someone may be struggling, be sure to act on it. Say that you've noticed changes. Show them that you care and are concerned for their well-being. Listen to what they have to say and don't judge. Ask them questions and reflect with them on their responses. Then, connect them with the appropriate help if they need it. Remember that you're not their doctor and your role is to purely ask questions. Listen and connect them to what they need. By doing this, you take care of both them and yourself. Now you understand the issue. You know why it's important and you know how to help someone in need. So the last thing you can do is go out and make a difference. Help eliminate stigma in your life and in your greater community. Go out and make some noise.